What is childhood gigantomastia? It is the abnormal growth of the breast at very early age. At 13-14 years of the age, I have seen a lot of the girl child coming with a D cup size and the problems like a neck pain, back pain, all skin related issues like a skin excoriation, and lot of girl child they refuse to go to the school because of the bullying by the colleagues as well as the opposite gender. It's really a disturbing problem for anybody, not only the kid, even the parents are very much worried about it. I used to receive lot of these kind of patients from small villages across Tamil Nadu. So I'm very happy that at least doctors there they're understanding this issue and they're referring the patients properly. So lot of patients, lot of the girl child with this problem, they don't even aware that there is a solution for it. That is a very sad part of this also. So this treatment is, we have to see your hormonal levels. If the endocrinologist says that surgery will be useful, definitely we'll help you with the surgery. So the surgeries, breast reduction surgeries always carries a scars. When there is a childhood gigantomastia, most of the time you need the inverted teeth kind of a scar. One scar comes around the areola, one vertically like this, one horizontally like this. This kind of a scar will come in the childhood gigantomastia breast reduction surgeries. So you have to understand few pros and cons in this procedure, because when they bringing the children, they always concern about the future marriage life and how she is going to tell the bridegroom and how they are going to inform the in-law families. So this kind of lot of the social pressure also added to this when they approach us. So you have to understand what all the issues happen because of the gigantomastia. As I said earlier, sometimes there will be a reduction in the sensation of the nipple areola. The pigmented part of the nipple areola, my sensation will comes down a little. Though it is rare in the medial pedicle where the technique what we follow, but few cases it is seen. Second, breastfeeding. Since we keep lot of breast tissues inside, there is a possibility of breastfeeding for sure, but still the milk secretions won't be adequate to fulfill the baby's needs, so they might need a supplement during the lactation period. One more thing is scar. Obviously, to prevent the further scar worsening, in darker skin sometimes the scar becomes a little bigger. Do you need to use something called a silicone gel sheet and some creams and some laser techniques to make the scar looks much better. Another thing is, sir, shall I tell all these things to the bridegroom? Obviously yes. If you are not telling those things to the bridegroom, it becomes a trust issue. Then lifelong you will end up in a big trouble. So the guys will understand, definitely they will agree for it. You don't worry about it. So make them understand before the marriage itself. These are all very important aspect of the surgery. Definitely this childhood gigantomastia is treatable problem, and post surgery you need to meet a endocrinologist and us regularly to avoid the further recurrences. So hope you understand this procedure. Hope you make this knowledge reachable to the needy people. Thank you.